Non-communicable diseases, NCDs, are chronic conditions that progress slowly and are not caused by infectious agents. They include cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Understanding the risk factors for these diseases is crucial for prevention and management. Risk factors can be categorized into modifiable and non-modifiable types, and addressing them can significantly reduce the incidence and impact of NCDs. Modifiable risk factors include unhealthy diet. Diets high in saturated fats, trans fats, sugar, and salt can increase the risk of cardiovascular diseases, diabetes, and certain cancers. A lack of fruits, vegetables, whole grains, and lean proteins contributes to poor health outcomes. Physical inactivity. Sedentary lifestyles are linked to obesity, cardiovascular diseases, diabetes, and certain types of cancer. Regular physical activity helps maintain a healthy weight, reduces blood pressure, and improves heart health. Tobacco use. Smoking is a leading cause of lung cancer, chronic respiratory diseases, and cardiovascular diseases. Exposure to secondhand smoke also increases the risk of these conditions. Excessive alcohol consumption. Heavy drinking is associated with liver disease, certain cancers, hypertension, and cardiovascular diseases. It can also lead to weight gain and obesity, further increasing the risk of NCDs. High blood pressure, hypertension. Hypertension is a major risk factor for heart attacks, strokes, and kidney disease. It can be managed through diet, exercise, and medication. High blood cholesterol. Elevated levels of low-density lipoprotein, LDL, cholesterol contribute to the buildup of plaques in arteries, leading to atherosclerosis and cardiovascular diseases. Managing cholesterol levels through diet, exercise, and medication can reduce these risks. Obesity. Obesity is a significant risk factor for diabetes, cardiovascular diseases, and certain cancers. It results from an imbalance between calorie intake and expenditure. Stress and mental health. Chronic stress can lead to hypertension, heart disease, and mental health disorders like depression and anxiety. Managing stress through healthy lifestyle choices, relaxation techniques, and professional help is essential. Non-modifiable risk factors include age. The risk of NCDs increases with age. For instance, cardiovascular diseases and cancer are more common in older adults. Gender. Certain NCDs have different prevalence rates between men and women. For example, men are generally at higher risk for heart disease at a younger age, while women's risk increases after menopause. Genetics and family history. A family history of certain diseases, such as heart disease, diabetes, or cancer, can increase an individual's risk. Genetic predispositions play a role in the development of some NCDs. Socioeconomic and environmental factors include socioeconomic status. Lower socioeconomic status is linked to higher rates of NCDs, due to factors like limited access to healthcare, healthy foods, and safe environments for physical activity. Education and income levels also influence health behaviors and access to medical care. Urbanization. Rapid urbanization can lead to lifestyle changes that increase NCD risk, such as reduced physical activity and increased availability of unhealthy foods. Urban environments can also expose individuals to higher levels of pollution and stress. Environmental factors. Air pollution is a significant risk factor for respiratory diseases and cardiovascular diseases. Exposure to hazardous substances in the workplace or living environment can lead to various health issues, including cancers and chronic respiratory diseases. Many of these risk factors do not operate in isolation, but interact in complex ways, compounding their effects. For instance, an unhealthy diet can lead to obesity, which in turn increases the risk of diabetes and cardiovascular diseases. Similarly, stress can contribute to unhealthy behaviors like smoking and excessive alcohol consumption, further elevating the risk of NCDs. There are ways of mitigating risk factors including public health initiatives. Governments and health organizations can promote policies that encourage healthy eating, physical activity, and smoke-free environments. Public awareness campaigns can educate individuals about the risks of NCDs and the importance of regular health screenings. Personal health management. Individuals can take proactive steps to reduce their risk by adopting healthy lifestyle habits, such as eating a balanced diet, exercising regularly, avoiding tobacco, and moderating alcohol intake. Regular health checkups and screenings can help detect early signs of NCDs and allow for timely intervention. Healthcare interventions. Access to healthcare services, including preventive care, treatment, and management of chronic conditions, is crucial. Healthcare providers can offer guidance on lifestyle changes and prescribe medications to manage risk factors like hypertension and high cholesterol. Understanding the risk factors for non-communicable diseases is essential for preventing and managing these chronic conditions. By addressing modifiable risk factors through lifestyle changes and public health measures, and recognizing the role of non-modifiable factors, individuals and communities can work towards reducing the burden of NCDs. A holistic approach that includes education, policy changes, and personal responsibility is key to combating these prevalent health challenges.